morning. I'm Celeste Ortiz, and I'm here to introduce Scan and Sachin Jain. Yes, the recipient of tonight's Champion for Health Award. Scan is a 45-year-old nonprofit organization that was founded on the premise that life could be improved for older adults. As a proud member of the Scan board, I've had the opportunity to work alongside Sachin, to see his passion for his work, to witness his enthusiasm for the cause of keeping seniors healthy and independent, and to feel his desire to improve America's healthcare system for everyone, regardless of what zip code they're born in, how much money they have, the color of their skin, or whether they even have a roof over their head. Sachin Jain embodies the spirit of Scan and the values of the Partners in Care Foundation.
Sachin has done groundbreaking work addressing social isolation and loneliness and developed innovative services for older populations with complex needs, and he's experienced what it takes to make and implement policy. So with great honor and pride, I invite Dr. Sachin Jain to please join us here on stage.
I want to give a big shout out to the Scan team. You are the best. You are the best team in the business. You are some of the most special people I've had the privilege of working with. You follow along with my crazy ideas. You don't say no as much as you probably should. But we have a lot of fun doing everything that we're doing, and 2 years ago I joined you as a stranger, and today I feel like we're all family, and I just want to express a ton of gratitude to all of you. It means a lot to me that you're here tonight. It means a lot to me that we're all on this journey together. Want to express appreciation for my family. They weren't able to join us because of COVID and some of the frailty that we're experiencing with our own family, but want to just express a lot of gratitude to my parents. I think about immigration as being almost a traumatic event in the lives of people like my parents. They pick up, come from nothing, come to a country where they know nobody, and they make a life, and they make a life for their kids so that we can try to contribute and try to make the world a little bit of a better place. And they've just been such an example for my siblings, my nephews, and just have so much love and appreciation for everything that they do, as all of us do as we progress in our lives. I think we see parts of our parents' journey expressed in our own lives, and it's just, I think incredibly humbling to be here. And I miss them, and I wish they could have been here, but just want to say thank you to them in absentia. We're at an inflection point in U.S. healthcare. I would say we've been at this, game of trying to make healthcare better for, the better part of the last 30 or 40 years. I would say in some ways, there have been just dramatic improvements in care in this country. Through the Affordable Care Act, we see 20+ million more Americans have access to healthcare than they did before. Through the scientific advances that we see through the biopharmaceutical industry, we take diseases that were previously death sentences when I was in medical school have become chronic diseases. Things like HIV and cystic fibrosis are now treatable. And so I think we've seen a lot of progress in a lot of ways, but we're also in, I think, incredibly perilous times. Trust in U.S. healthcare has never been lower. Even though we developed this incredible vaccination, a good chunk of the American population has significant distrust in science, distrust in the healthcare system, distrust in their doctors, distrust in their health plans. It is a cause for a lot of potential cynicism. And I watched a lot of Ted Lasso during the pandemic. How many of you watched Ted Lasso? And so, and I'm also watching a lot of Obi-Wan right now. And so that gives you a little window into my life. And what I can tell you that I took away from Ted Lasso was the importance of being what I call post-cynical. Getting out of this sort of day-to-day of just kind of seeing things as being routine and starting to see the goodness in everything. And what I take away from Obi-Wan is that Disney finally figured out how to make Star Wars work. But in all reality, I think there are times when we feel in this industry that there are dark forces at play, that the right things aren't necessarily happening as much as they should, that patients don't get what they need, and it's easy to start to lose hope. It's easy to start to lose a belief that things can be better. I do have these moments of doubt where I'm sitting in quiet and wondering, what are we really accomplishing? Because some things are getting better, but a lot of things are getting worse. So, but I will say, being in rooms like this one gives me hope, gives me a ton of energy, a ton of positivity, because I'm surrounded by, I think, a group of people, a community of people who in their own ways are trying to make things better within their systems, within their organizations, within our society. And I think there's a lot of reasons for hope that we sometimes ignore when we're looking at the big picture, because the big picture sometimes looks chaotic and unclear and ugly. But when you start to kind of zero in on what's happening at the ground level between people and patients, there are just beautiful moments every single day. I think in the early days of the pandemic, many of us were worried. We were worried about what was going to happen to us, what was going to happen to our communities, what was going to happen to our family members. And I just think about the people at SCAN who just said, let's call our members and just check up on them and make sure that they're okay, and reach out to people in a very human way and make sure that their needs are being met. I think about my mentor in this industry, Liba Lesson. Many of you know Liba. Please give Liba a round of applause if you know Liba. And I think about the fact that she defined for us a view through her work at CareMore, a view of what was possible when you actually started to innovate, when you started to move beyond the simple talk tracks that we sometimes reflects to in this industry about innovation and transformation and all the things that make us jaded, and start to think about just a basic human connection that you can actually create with people when you try to create that connection. Liba inspired me when I was at CareMore to create what was called the Togetherness Program, which was really an outreach program for lonely and socially isolated people. And I've just been so humbled to see this little program that we started in Downey, California, extend to SCAN in Long Beach and to all the members that we serve, but also inspire similar efforts across the industry. Because at the end of the day, we sometimes lose sight of the fact that what we're here to do is to serve people who need us. And we sometimes have this tendency to normalize the abnormal in American healthcare. And I think if you take a big step back and try to be as human as possible and do as much as we can to remember that at the end of every phone call, at the end of every patient encounter, at the end of every touch is another person like us who needs humanity, who needs personal care, then we can actually deliver it. I think about a woman named Michelle who our SCAN's homeless medical group, Healthcare in Action, reached out to, and I'm very humbled by the fact that we've not only taken care of her medical needs, but we've also housed her, right? And those are the kinds of things that I think we have to focus on and we have to really connect to is ultimately the basic purpose of being here is to serve others. And so, again, I just want to say thank you to everyone in this room. I think everyone in this room embodies this spirit, but I would actually challenge all of you to go to your own organizations tomorrow morning and wake up and challenge your own status quo and ask how we can be better. Ask how we can all be partners in care, because I think if we do challenge our own status quo, the next 20 years are going to be a lot better than the last 20 years. And we'll be able to look back at the end of our careers and say, the US healthcare system is better. More patients are being served. there is less suffering, there is more health. That's what we're all here for, and I'm grateful to all of you for this recognition, but this really is recognition for, I think, all of the work that all of you are doing and in service of others. Thank you very much.